Okay, hello, my name is Moreno Hidalgo. I am a talk about 4 shared decisions for patients with aortic stenosis. Okay, the definition: aortic stenosis is one of the most common and most serious valve disease problems. Aortic stenosis is a narrowing of the aortic valve opening. Aortic stenosis restricts the blood flow to the left ventricle, the pressure in the left atrium.
The two approaches that we have available to us for your valve problem would be called symptom management and transcatheter aortic valve replacement. We are not going to talk about open heart aortic valve replacement today because you've already seen a surgeon and that's been deemed too risky of an option for you.
I'd like to make a decision with you. I'd like to share that decision process with you because I'm very knowledgeable about the procedures and about the risk of complications, but I'm not an expert in what your values are. You're the expert on what's most important.
So in deciding between these choices, we have to focus on several different aspects: how you might feel, what risks you take up front, and what you might expect down the road.
At 1 year from now, what are the things that are most important?
That's what I'm looking for out of life. I want a normal life back again.
Am I understanding you?
That's exactly it.
Since we've gone through the details of both
Yes.
choices and
Yes.
given your goals, it does seem to me
That
to be
would-
reasonable to think about this option for you.
The applications in medicine, we have the prognosis of aortic stenosis is with 19% of the patient present syncope, angina, or heart failure, which causes death within 2 to 3 years on average. Medicine interventions include the monitoring of vital signs, especially heart and respiratory rate, medication administration, pulmonary physiotherapy, and finally how to expectorate.
TAVR is a minimal invasive procedure, stands for transcatheter aortic valve replacement. Aortic stenosis is a disease of the aortic valve. The aortic valve is like the door of the heart, and when it becomes narrow, patients become symptomatic, meaning they have shortness of breath, chest pressure, sometimes they even pass out. So a TAVR is a procedure that can replace the traditional open heart surgery. So the procedure starts with numbing both groins. We put lidocaine under the skin, and that prevents the patient from having pain. The patient will be under light sedation, and we will insert catheters. Catheters are plastic tubes that allow us to inject contrast or advanced devices through them into the heart. We will then advance an aortic valve bioprosthesis. Currently at Tallahassee Memorial Healthcare, we have the 2 devices that are approved by the FDA to treat aortic stenosis. The Edwards valve is a balloon expandable valve. The valve is mounted on a balloon. So as a stent, you will put it in the position that you prefer and then inflate the balloon. That will expand the valve. Once expanded, the valve is already functioning. The Medtronic valve is contained within the catheter. The Medtronic valve is made of a material called nitinol. Nitinol is a material that has memory, so the valve is always wanting to be in their original position. We put it inside of the catheter, and once it's in position, we release it by removing the catheter. The valve deploys itself. By treating aortic stenosis with a TAVR, we are making patients live longer and better. That means no shortness of breath or chest pain or passing out while doing their regular activities or even exercise. The evidence has supported that the FDA has approved this therapy for people with intermediate risk for surgery. However, there are at least 2 trials that have shown that this is beneficial also for low-risk patients. So the population that will benefit from this procedure has broadened. The heart team is composed by several people, from cardiologists, invasive and non-invasive, heart surgeons, nurses, anesthesiologists, coordinators. We all are with one mission, which is to provide that patient the best option available.
The pros and cons. In pros, we have in recent years the development of better materials for the construction of mechanical valves, the advance in treatments. You may be able to resume your daily activities such as working, driving, and exercising over time. About the cons, we have the aortic valve stenosis can produce cons including heart failure, stroke, blood clots, bleeding, infections. The issue applied in Ecuador, percutaneous aortic valve implantation is a minimally invasive procedure to treat patients with severe aortic stenosis with high surgical risk. It is a highly complex surgery that is already in the country. Ecuador have a hospital trained to do this procedure. We have not any complications in the 7 cases we have. Patients have evolved satisfactorily and are in regular medical checkups. About the conclusion, aortic valve stenosis or aortic stenosis occurs when the aortic valve of the heart narrows, although its incidence in Latin America is low. It must be taken into account to be able to be diagnosed and apply a surgical treatment because if this disease is not diagnosed in time, the patient could be lead to his death. Okay, thank you.